Specifically in terms of the tummy procedures, the complications we worry about are bulging, which is like a pooch, and even an abdominal hernia. A bulge can happen when the tone in the muscle, so either the muscle is removed, so any procedure that removes muscle increases your risk of a bulge or a hernia.
Good to know.
Even if you preserve the muscle, like the deep flap does, you can't cut all the nerves that feed it and power it, because then the muscle becomes, essentially it's a paralyzed muscle.
Makes sense.
Paralyzed muscles waste away, they have no tone, they have no power, they don't work. And so then you can get a bulge. You can also get a bulge if you get a partial separation of the repair on the inside. So those are the most common reasons to get a bulge. Again, in experienced hands, the risk of abdominal complications with the advanced procedures, like the deep flap, the risk is 1% for a hernia, 3% for a bulge. With an SIA flap that doesn't even violate any of the deeper tissues, you don't have any risk of those two things happening.
Interesting.
Yeah. An abdominal complication, a bulge or a hernia, can be a very, very, very bad event for people.
Yeah.
It can create many chronic problems. It can require significant reconstructive surgery in some cases. Thankfully, that's rare. But so really, the best way to go about things is to prevent it from happening.
Yeah.
And so the way to prevent that is to preserve rather than try and patch, right? So preserve the muscle, preserve the nerves that feed the muscle. So the deep flap or the SIA flap are very much the way to go in terms of minimizing risk.